We have seen the conduct of labor, the first stage and the second stage of labor in our previous videos. Now let's see the conduct of labor, especially the management of the third stage of labor. The management of third stage of labor. As we all know, the third stage of labor extends from the delivery of fetus to the delivery of the placenta. And the third stage is the most important stage of labor, in which we should carefully note for the condition of the uterus, the condition of the patient, the amount of hemorrhage and the signs of placental separation. And one of the major complication of third stage of labor is postpartum hemorrhage. So our aim should be to prevent the postpartum hemorrhage from occurring. And coming to the delivery of the placenta can be delivered by two ways. Either the placenta separates itself, so we give some time for the separation of placenta and then it delivers by itself, or we deliver the placenta by active management of third stage of labor. First, let's see the signs and symptoms of separation of placenta. The signs and symptoms would be pain associated with uterine contractions. There will be some amount of fresh vaginal bleeding. And the cord lengthens, especially the part which is outside the vulva. The extra vulval part of the cord lengthens because of the separation. Then the uterine fundus rises above the umbilicus. And the uterus becomes firm and globular. And then if the fundus of the uterus is grasped and raised, the cord will not recede back. Also, there will be an elevation which is soft over the pubic symphysis. And a depression immediately above it. All these are the signs and symptoms of placental separation. Now coming to the delivery of the placenta. Usually the placenta gets separated within 2 to 5 minutes of the birth of the baby. So this can be noted by the signs and symptoms of the separation as we have seen above. And for the delivery of placenta, the mother may be asked to bear down with each uterine contraction, due to which there will be increased intra-abdominal pressure and the placenta can be expelled. So, if the spontaneous expulsion is not there, so if the spontaneous expulsion of the placenta does not occur, then during the uterine contraction, we give pressure on the fundus to move the placenta which has been detached into the vagina. So, as the pressure is applied, the umbilical cord is kept taut. And then we use the left hand to gently massage the fundus of the uterus and the right hand to hold the cord and to take off the weight of the emerging placenta. And then we pull the cord by gentle traction in the axis of the outlet, and so there will be the delivery of the placenta. This is called as Brandt-Andrews maneuver. We will see this and understand with the help of a diagram. So, this is the Brandt-Andrews method for the delivery of placenta. Here we give a pressure over the fundus of the uterus with our left hand. So, a pressure is given over the fundus with our left hand by massaging the uterus so that it contracts, and then it pushes the uterus firmly, whereas using the right hand we hold the cord and we give gentle traction in the axis of the outlet as it is given here. There is a gentle traction in this direction so that the placenta separates and comes out, and thereby it is expelled out. Now, coming to the objectives. During the management of third stage, the important objectives should be to promote natural separation of placenta, to decrease hemorrhage and to prevent blood loss, and then to make sure there is good and permanent contraction and retraction of the uterus. These are all the objectives for the management of third stage of labor. Now, let us see about the active management of third stage of labor, referred to as AMSTIL, which is active management of the third stage of labor. So, the active management of third stage of labor is performed to decrease the blood loss and thereby preventing the postpartum hemorrhage, which is a very serious complication of the third stage of labor. So, the active management of third stage of labor includes 3 steps, which is first, administration of uterotonic. Oxytocin is usually preferred within 1 minute of the delivery of the baby. The second step would be the controlled contraction for the delivery of the placenta by the Brand-Andrews method, which we have just now discussed. Next would be the uterine massage. These are the three components of the active management of third stage of labor. Let's see about one by one. So the three steps of active management of third stage of labor include the administration of uterotonics within 1 minute of delivery, second is controlled contraction, and the third is the massage of the uterus. First, in administration of uterotonic within 1 minute of delivery, first we deliver the baby and we rule out the presence of any additional babies in case of multiple pregnancies. And then the uterotonic of choice would be oxytocin 10 units given intramuscularly as soon as the baby is delivered, that is within 1 minute. And then we dry and warm the newborn. We immediately initiate breastfeeding, wait till the pulsation of the cord stops, and then we clamp and cut the cord. This is the first step. Coming to the second step, which is controlled contraction. We clamp the cord close to the perineum, stabilize the uterus using counter pressure and gently pull downwards on the cord, and then we encourage the mother to push. Continue applying counter pressure, gently hold the cord and wait for next contraction. Repeated controlled contraction is performed, and as the placenta delivers, you should hold it in two hands and gently turn until the membranes are twisted on themselves until they slowly deliver. This is the second step. Whereas the third step is the massage of the uterus. So we should immediately massage the fundus of the uterus until it contracts. If the membranes tear, we should gently examine the cervix, remove any pieces of membrane which are visible, and important thing is we should ensure that none of the placenta is missing or none of the part is remaining inside, and we should take appropriate action if retained placenta fragments are suspected, and we should palpate for the contracted uterus every 15 minutes. Repeat uterine massage as needed during the first 2 hours. Ensure the uterus does not become soft after stopping the massage, and we should teach mother to massage her own uterus as needed. So this is all the important points regarding the active management of the third stage of labor and its algorithm. The next step would be to repair the episiotomy and perennial lacerations, if any. These lacerations are classified into 4 degrees. The first degree lacerations involve the perineal skin and the vaginal mucous membrane. The second degree lacerations include the fascia and the muscle. Third degree is still more deeper to it, involving the anal sphincter. And the fourth degree perineal laceration, it extends through the rectal mucosa. So we should repair the lacerations based on its degree. Next, after completion of the third stage, we should check for certain things. First, we should check for the placenta, the membranes and the cord for completeness and for any anomalies. Next, the external genitalia should be thoroughly cleaned with antiseptic. Next, we should give a sterile or antiseptic pad to the vulva. Then there is fourth stage of labor, which is 2 hours from the end of the third stage. Then breastfeeding can be started as early as possible for a normal vaginal delivery. Especially within the first half an hour of the delivery of the baby. Finally, we should confirm that the uterus is well retracted. There should not be any bleeding, and the pulse rate is less than 100 and it is slowing down. All these should be noted before the So this is how we manage the third stage of labor, which is the most important stage in labor. And the important thing in this is active management of the third stage of labor. So thank you.